9. Fruits that could quietly raise your stroke risk after 60. You've always heard fruit is good for you. Natural, colorful, packed with vitamins and fiber, how could it possibly be harmful? But if you're over 60, the truth is, things have changed. Your body doesn't process food like it used to. Your kidneys filter more slowly. Your blood vessels are more fragile. And your brain? It's more sensitive than ever to shifts in blood pressure, hydration, and medication. Hi, I am Dr. Robert Peterson. For over 40 years, I've worked with seniors across the country helping them stay sharp, balanced, and independent. And today, I want to share something surprising. Even the most innocent fruits could quietly increase your stroke risk if eaten the wrong way, at the wrong time, or alongside certain medications. We're not talking about junk food or sodas. We're talking about the fruits in your fridge right now. Mango, strawberries, even bananas. In this video, I'll walk you through 9 common fruits, many of them praised as healthy, that can disrupt blood pressure, spike your sugar, or thin your blood too much as you age. And more importantly, I'll show you how to eat smarter, not with fear, but with wisdom. Because you've come too far in life to let a piece of fruit steal your speech, your strength, or your independence. So let's get started. And if you find this video helpful, please comment 1 to let us know you're with us. Mango, blood sugar spikes and medication interference. Mango feels like a treat, soft, golden, naturally sweet. It's often seen as a healthy dessert, a tropical reward that replaces cookies or cakes. But for seniors, especially those managing blood pressure, diabetes, or taking medications daily, mango may quietly be making things worse. Here's why. Just 1 cup of mango has nearly 45 grams of sugar, more than many donuts. And unlike whole grains or fiber-rich carbs, this sugar enters the bloodstream fast. Your insulin surge, your arteries tighten, and in older adults, this pattern of spike, crash, spike can damage the delicate walls of the blood vessels in your brain. Tiny cracks form. Your body tries to repair them by forming blood clots. That's how stroke risk increases quietly, invisibly. But that's not all. Mango also contains natural plant compounds that interfere with how your liver breaks down medications, especially drugs used for blood pressure, heart rhythm, or cholesterol. One of those compounds, called mangiferin, can slow the cytochrome P450 enzyme, which is responsible for clearing drugs from your body. When this system slows down, medication builds up. Even at normal doses, you may suddenly experience side effects like dizziness, fatigue, or dangerously low blood pressure, all of which can lead to falls, confusion, or stroke. I remember a patient, Mr. William Booker, 83, a retired firefighter. He replaced cookies with dried mango slices every afternoon. But he was also on meds for high blood pressure and atrial fibrillation. Weeks later, he collapsed. The tests showed low blood pressure, irregular drug levels, and a minor stroke. The mango wasn't poison, but in his aging body, it tipped the balance. If you enjoy mango, eat just a few bites, always with protein or healthy fat, and never at night. If you take prescription meds, especially for the heart or blood pressure, ask your doctor first, because one sweet slice in the wrong body at the wrong time can cause more harm than you think. Strawberries, mold, pesticide, and gout triggers. Now, if mango's sugar surprised you, strawberries might shock you even more. Bright red, heart-shaped, and served at health retreats and hospitals across the country. Strawberries are often seen as the picture of wellness, but for older adults, especially those with high blood pressure, joint pain, or kidney issues, strawberries may be hiding 3 serious risks. First, pesticide exposure. Strawberries are consistently ranked at the top of the dirty dozen list, meaning they carry some of the highest pesticide residues of any fruit, even after washing. These chemical residues don't just irritate your gut, they're neurotoxic, especially for seniors. Over time, they build up in the brain, increase oxidative stress, and weaken blood vessel walls from the inside. The result? Higher risk of tiny strokes, memory loss, and long-term vascular damage. Second, hidden mold. Strawberries spoil quickly. Even a slightly overripe berry may be growing invisible mold that produces mycotoxins, toxins that in sensitive older adults, can trigger inflammation and blood vessel constriction. Third, purines. Strawberries contain purines, compounds that break down into uric acid. And for people with a history of gout, kidney disease, or vascular inflammation, elevated uric acid is dangerous. It can raise blood pressure, trigger swelling, and increase clot risk. I once treated Mrs. Elaine Carter, 80, from Michigan. She ate strawberries every day, fresh in the summer, frozen in smoothies during winter. She had mild hypertension and occasional joint swelling. One morning, she awoke with numbness in her hand and slurred speech. She'd had a minor stroke. Lab tests showed elevated uric acid, low-grade inflammation, and signs of neurotoxicity likely linked to pesticide buildup. If you eat strawberries, always buy organic, wash thoroughly, and limit how often you eat them. Avoid frozen smoothie packs unless you trust their source. And if you have gout or kidney issues, ask your doctor first. Strawberries may look sweet and innocent, but inside an aging body, they can stir up far more than flavor. Cherries, hidden source of salicylates. Cherries are often seen as one of the healthiest fruits on the plate. Bright, tart, antioxidant-rich, they're recommended for joint pain, heart health, and even sleep. But for older adults, especially those on daily medications, cherries come with a hidden risk most people never hear about. The danger lies in a natural compound called salicylate, the same active ingredient found in aspirin. Salicylates help thin the blood and reduce inflammation. That sounds like a good thing, unless you're already taking blood thinners, daily aspirin, or medications like Plavix or warfarin. When you combine drug-based blood thinners with cherry-based salicylates, your blood may become too thin to clot properly. This can lead to bleeding in the brain, known as a hemorrhagic stroke. And unlike clots, these strokes are much harder to stop and often more devastating. I remember a patient, Mr. Daniel Rhodes, 84, a retired train conductor. He was on low-dose aspirin after a heart scare and enjoyed a bowl of cherries every night after dinner. No sugar, no junk food, just nature's dessert. Weeks later, he began having headaches, dizziness, and nausea. Then one morning, he collapsed. At the hospital, doctors found a small brain bleed. His medication dosage hadn't changed, but the cherry salicylates had quietly tipped his blood too far. The lesson? Natural does not mean harmless. If you're on any medication that affects blood clotting, be cautious with cherries. Avoid cherry juice, cherry concentrate, and large daily portions. A few here and there are likely safe, but they should be a treat, not a daily habit. And always let your doctor know if you're eating them regularly. Because when blood gets too thin, it doesn't just flow, it leaks. And inside the brain, even a small leak can change your life forever. Apples, surprise sugar trap. An apple a day keeps the doctor away. You've heard it all your life. And for younger, active adults, there's truth in it. But if you're over 60, especially managing diabetes, blood pressure, or brain health, that sweet, crisp apple might not be helping you as much as you think. Here's why. Many popular apple varieties in the US like Fuji, Honeycrisp, and Gala have been bred for maximum sweetness, not nutrition. And while apples do contain fiber and vitamins, these sugary types have a high glycemic load, meaning they cause rapid spikes in blood sugar, especially if eaten alone or on an empty stomach. That sugar spike may feel harmless, but inside your body, it starts a chain reaction. Blood sugar surges, insulin increases, blood vessels tighten, inflammation begins. Over time, this cycle can weaken the walls of your arteries, especially those feeding your brain. Tiny micro tears form. And how does your body repair those tears? By forming clots, which is exactly how many strokes begin silently, without warning. One of my patients, Mrs. Louise Hammond, 81, believed she was doing everything right. No cookies, no chips, just a large Honeycrisp apple every afternoon. But she was also insulin resistant, and that daily sugar load was overwhelming her aging arteries. One evening, she suddenly lost her ability to speak. Scans revealed a minor stroke. The cause? Blood vessel inflammation and clotting likely triggered by repeated sugar spikes. So what's the smart way to enjoy apples? Choose lower sugar varieties like Granny Smith. Never eat apples alone. Pair with almond butter or cheese to slow digestion. Avoid sweet apples at night. When your body can't handle sudden sugar swings, apples aren't the enemy. But without context, even a fruit as wholesome as this can quietly tip your brain into danger. Oranges. Citrus interactions with medications. After apples, you might think oranges are a safer choice, packed with vitamin C, refreshing, and often served at breakfast. But for seniors on heart medications, blood pressure drugs, or statins, oranges may quietly become a dangerous mix. Why? Citrus fruits like oranges contain a natural compound called furanocoumarin. It sounds harmless, but this chemical can block key enzymes in your liver, specifically the ones responsible for breaking down medications. When that happens, your body can't properly process certain drugs. This can cause medication levels to build up to toxic amounts, or drugs to be flushed out too quickly, making them ineffective. Both scenarios are risky. Toxic levels can damage organs, cause dizziness, or trigger a stroke, and low levels can leave your heart unprotected. One of my patients, Mr. Elmer Bryant, 79, drank a glass of fresh squeezed orange juice every morning, a routine he believed was healthy. But he was also on a statin for cholesterol and a calcium channel blocker for blood pressure. Over time, he began feeling dizzy and confused. One morning, he collapsed. Tests showed a buildup of both medications and a minor ischemic stroke caused by unstable blood pressure. The juice had quietly interfered with his liver, tipping his medication levels into danger. So, what's the takeaway? Avoid drinking large amounts of orange juice if you're on medication. Don't mix oranges or grapefruits with statins, blood pressure meds, or blood thinners without asking your doctor. If you love citrus, opt for clementines or a splash of lemon or lime in water. They carry less risk. Oranges aren't evil, but for seniors with a medicine cabinet, they deserve respect. Because it's not just the pills you take, it's what you take them with that can protect or harm your brain. Watermelon. Not always hydrating. Watermelon feels like summer. It's cool, juicy, refreshing, and over 90% water. Surely it must be good for hydration, right? Not always, especially if you're over 60 and taking medications for blood pressure, heart failure, or swelling. Here's what most seniors don't realize. Watermelon acts as a natural diuretic. It makes you urinate more often. That sounds harmless. Unless your body is already losing fluids due to medications like diuretics, water pills, or ACE inhibitors. Too much urination leads to silent dehydration. You may not feel thirsty, but your body is drying out overnight. And when that happens, your blood thickens, turning syrupy. It moves more slowly, and inside narrow, aging arteries, that thick blood is more likely to form clots, especially during the night when circulation naturally slows. That's exactly what happened to one of my patients, Mr. Howard Larkin, 82. He was doing everything right, walking daily, avoiding sugar, eating healthy. Each night, he'd enjoy 2 big slices of watermelon after dinner, but he was also on a water pill. One morning, he woke up dizzy. When he tried to stand, he collapsed. At the hospital, his blood pressure was dangerously low, and tests showed a small stroke likely triggered by overnight dehydration and thickened blood. So what can you do? Eat watermelon earlier in the day, not at night. Pair it with electrolytes like a pinch of sea salt or coconut water. And if you're on diuretics or heart meds, talk to your doctor before eating it regularly. Watermelon can still be a healthy treat, but for seniors, it's not just about what's in the fruit, it's about what it takes out of you. Pineapple, a dangerous combination of acid and sugar. Pineapple feels like a vacation in every bite. Sweet, tangy, tropical. Many seniors enjoy it as a light dessert, believing it helps with digestion and keeps things natural. But for people over 60, especially those on medications or with sensitive digestion, pineapple can quietly create the perfect storm, combining sugar, acid, and enzyme activity in ways that affect the brain and blood vessels. Let's break it down. First, pineapple contains bromelain, a natural enzyme that helps digest proteins. While small amounts may aid digestion, too much, especially with medications, can interfere with blood clotting by reducing platelet function. For someone with thinner blood vessels or already on blood thinners, this increases the risk of unexpected bleeding or clots. Second, pineapple is high in sugar, over 16 grams per cup. It has a high glycemic index, meaning it spikes blood sugar rapidly. If eaten late in the day, This sugar isn't burned for energy. It lingers in the bloodstream, stressing the arteries while you sleep. Third, the acid content in pineapple is among the highest of all fruits. This can trigger silent acid reflux, which doesn't always feel like heartburn. Instead, it can cause microaspiration and changes in nighttime breathing that reduce oxygen to the brain, one of the biggest stroke triggers during sleep. I treated a patient, Mrs. Clara Hughes, 77, who replaced dessert with pineapple slices every night. One morning, she woke up disoriented, slurring her words. She'd had a posterior stroke, the kind that affects balance and speech. Her blood work showed elevated glucose, signs of reflux, irritation, and platelet changes likely tied to her pineapple habit. What to do? Eat pineapple in small amounts. Early in the day, never eat it before bed, and avoid it altogether if you're on blood thinners, unless your doctor says it's safe. Pineapple may feel light and fresh, but inside the aging body, it can become anything but gentle. Grapes. Sugar bomb in a tiny package. They're small, they're sweet, and they feel harmless, a bowl of grapes while watching TV or reading the paper. But for older adults, especially those with blood sugar issues, blood vessel weakness, or prediabetes, grapes may not be as innocent as they seem. Here's why. Grapes, especially seedless, extra sweet varieties are packed with glucose and fructose, two fast-acting sugars. They digest quickly, rushing into your bloodstream and causing sudden sugar spikes. Your insuline surge, blood vessels tighten, and inflammation begins inside the arteries, including those in the brain. Repeated sugar spikes can lead to micro-tears in blood vessel walls. Your body repairs them with clots, and over time, that quiet cycle increases the risk of ischemic stroke, the kind that blocks blood flow to the brain. I once treated Mrs. Jeanette Morris, 80, a retired teacher. She avoided soda and processed snacks, believing her daily bowl of red grapes was a healthy habit. But one morning, while writing a birthday card, her hand shook. She couldn't remember the word congratulations. She was rushed to the ER, a mini stroke, or thanks in advance. Her labs showed midday sugar spikes and chronic low-grade inflammation in her blood vessels, likely caused by years of over-snacking on grapes, especially without protein or fiber to slow digestion. So what should you do? Don't eat grapes on an empty stomach. Pair them with protein, a slice of cheese, or a few almonds. Keep portions small and avoid eating them late at night. And if you have diabetes or take blood pressure medication, ask your doctor first. Grapes may be tiny, but for the aging brain, they can carry more weight than you think. Bananas. Too much potassium, too quickly. Bananas are often seen as the perfect fruit. Soft, easy to chew, good for the heart, loaded with potassium and recommended by doctors for decades. But for seniors, especially those with high blood pressure, kidney issues, or on common medications like ACE inhibitors or diuretics, bananas may be too much of a good thing. Here's what most people don't realize. Potassium helps regulate heart rhythm and fluid balance. But when you're over 60, your kidneys naturally slow down. They don't filter potassium as efficiently, especially if you take blood pressure meds. That means potassium can build up in the blood, leading to a condition called hyperkalemia. What happens then? Your heart misfires, blood vessels tighten, and in the brain, this imbalance can trigger sudden blood clots, sometimes overnight, while you're sleeping. I remember a patient, Mr. Raymond, 66, retired carpenter. He ate healthy, exercised, and every morning he'd slice a banana over his oatmeal and take his blood pressure pill with a glass of orange juice. One morning, his wife found him collapsed in the bathroom. His speech was slurred. He couldn't move his left side. At the hospital, scans confirmed a small stroke, and his blood potassium was dangerously high. 2 simple bananas a day, combined with medication, had quietly tipped his body into crisis. So how can you enjoy bananas safely? Stick to half a banana per day, eaten in the morning. Pair with protein like Greek yogurt or nuts to slow absorption. Avoid banana smoothies, banana bread, or eating bananas late at night. And if you take heart or blood pressure meds, ask your doctor how potassium-rich foods affect you. Bananas aren't bad. But at this age, even healthy habits need adjusting. Because what once protected your heart may now challenge your brain. You've heard it all your life. Fruit is nature's medicine. And for much of your life, That was true, but after 60, the rules change. Your kidneys slow down, your liver processes medication differently, your blood vessels become thinner, and your brain becomes more sensitive to small shifts in sugar, hydration, and blood pressure. That's why the same fruit that once nourished you can now quietly tip your body out of balance. We've covered 9 common fruits: bananas, grapes, oranges, watermelon, pineapple, apples, cherries, strawberries, and mango, each with unique risks for older adults. But this isn't about fear. It's about respecting how your body changes and adapting with wisdom. Because you are not fragile, you're evolving. So here's what matters most. Watch your timing. Eat fruit earlier in the day. Pair fruit with protein or healthy fat. Talk to your doctor if you're on medications. Even natural foods can interfere. And pay attention to how your body responds. Dizziness, fatigue, or brain fog are whispers worth listening to. You don't have to give up sweetness. You just have to meet your body where it is not where it used to be. If you found this video helpful, comment 1 below to let us know. Or 0 if there's something you'd like us to improve. And don't forget to like, share, and subscribe for more health insights made just for you. Stay sharp, stay strong, stay you.